everyone. Thank you for being a part of continuous learning with Bioguard. It is my pleasure to introduce our webinar speaker, Dr. Shijie Cao. Dr. Cao received his DBM from Huazhong Agricultural University in China and master's degree in veterinary medicine from National Zhongxin University in Taiwan. He is a highly skilled veterinarian with over 7 years of experience in the field. Dr. Cao's expertise lies in the area of internal medicine for small animals. He has been recognized for his exceptional work by Royal Canin and Feline in Belgium. In 2023, Dr. Cao founded Cotton Veterinary Hospital in Hangzhou, China, where he continues to provide excellent care to animals and also conducts training programs for young veterinarians. In today's lecture, Dr. Cao will present a case-based approach to canine and feline lower urinary tract diseases. Using real cases, clinical cases, we'll explore diagnosis, differential diagnosis, and management of conditions such as cystitis, urolithiasis, and urethral obstruction. The lecture emphasizes practical tools, treatment protocols, and clinical decision-making to help practitioners apply evidence-based strategy in daily practice. We are delighted to welcome Dr. Cao as our speaker.
Thank you very much, Robert, for your introduction. It's really my pleasure to come back to Bioguard continuous education webinar this year. And this time, my topic would be talking about canine feline lower urinary tract disease. So generally, it's kind of like a big topic. In the very beginning, I'm thinking like how to make it more like meaningful for the clinicals. So maybe this time I would be more focused on urolase, the urinary bladder stones. Today this time this 1 hour course we will have like 4 cases focus on dogs and the cats uroliths. There are different cases. They will give us different tips and tricks. So let me introduce myself again. And I'm Shijie Cao, and you can call me CJ. I'm the founder of the Hangzhou Cotton Veterinary Hospital, and I graduated from the Chongqing University and Huazhong Agricultural University. And I'm also a VESPA, the Veterinary Endocrinology Society of Pacific and Asia's regional communicating officer. So if you also have some interests on the endocrinology, can send email to me. This is the email in the bottom of the slides. So let's go forward to our first case. The first case, the name is Bing. She is a 5 years old female spayed Bichon fish, and she already have received 2 times of the cystotomies to remove the bladder stone. The first time would be like 2 years ago. After the surgery, the clinician send the stone out. The result come back would be Struvite stone. And about several months later, the stone grow back again, and being received the second surgery and to remove the bladder stone, the result come back would be the urate stone. And recently, in the recent several months, we find the stone has been come back again. And also, um, Bing has been on the Royal Canine urinary SO diet always, all the time. But still, the storm come back again and cause a clinical sign like a dysuria, stranguria, and hematuria. So, owner take Bing to me and to see if there is any other solutions we can help with Bing. We take an X-ray first. Definitely, we do see two major stones in the bladder, and the owner not only have give the Royal Canine urinary SO diet to Bing, but also tried the traditional Chinese medicine to dissolve the stone. It's failed, and the stone is keeps growing, and cause clinical signs. So then, if the case is come to your clinic, what you will do as a next step? First, will you do a surgery again to remove the stone? Second, will you change the diet to another diet like Royal Canine Urinary UC? Or will you try some other kind of medications to manage this kind of recurrent bladder stone? Or fourth option, will you want to try to do a urinalysis? Because I reviewed the history, the dog haven't done a urinary urinalysis yet. And we talked about the surgical option. Owner denied that she do not want let the dog to receive the surgery again, cause the she cause its surgery didn't fix the problem. Cause we do it one time, two time, it still recurs again and again. So let's have a look at the diet, the other diet. Why one option would be changed to the other diet, like urinary UC? Because a regular urinary SO diet, it would be mainly focused on the struvite bladder stones. The other would be calcium oxalate stones. The urinary UC can dissolve the struvite stones, but it cannot dissolve the calcium oxalate, but it can help to do not let the urinary oxalate stones to recur. But the animal has been on urinary SO all the time, but since the urinary SO didn't help to dissolve the stone and didn't help to prevent the stones to recur, the other option is we can change to the diet to the urinary UC. Why is it's UC? Why we can choose a UC? Because UC is a low purine diet. It can help to prevent the uric acid urine, urate stones. Previously, the history Bing has been presented with one time the stone would be the urate stone. So probably the UC diet can help to with UC stones. But definitely the urinalysis would be essential because sometimes we can get some informations or get some clues why it will happen again and again. So we did a urinalysis. We do find some many like cocci in the urinary tract. So the bacteria infection of the urinary bladder can be a major issue. Why the urinary stones can recur again and again? Because this kind of bacteria, they can produce a kind of enzyme. This enzyme will be a very important triggers to the the struvite stones recur and make the struvite not easily to be dissolved. And also we do see the other part of the urinalysis. The USG is not very high. There is no other things make us concerned. There is no like a glucosuria. So mainly issue would be the urinary infection. And so at this point of time, I want to know this kind of the urinary stone is recurrent from the struvite stone or recurrent from the urate stone, or the stone is not the struvite, not urate, is from other kind of stones. How can we differentiate what kind of stone it is before we do a surgery, before we send the stone to the reference lab to get a result? There is one application. It's developed by the Minnesota Urolith Center. The application, the name would be the MN Urolith Center. So you can use this kind of this application, and there is a function we can see is called CalcRad. We can take a picture of the bladder and of the stone. This app can automatically tell us what kind of stone it could be. So I take a picture, use this app. I take picture of the stone like the graph in the middle, and in the right, this app told me, oh, it's struvite stone. Okay, so right now we know this stone is struvite, but why the urinary SO diet didn't work at all? Because generally, in our knowledge, the struvite stone can be dissolved only the sole treatment is urinary diet can dissolve the stone already. Why this will happen again and again? Maybe the bacteria would be an important issue. So we did the urine culture. We do find the bacteria is pseudointermedia, Staphylococcus pseudointermedia, and this bacteria be resistant to many kind of antibiotics. Sorry, this report is all in Mandarin. The green label, which is noted, is which kind of bacteria is which kind of antibiotic is sensitive to this kind of bacteria. So right now we know um, why this recurrent stone is struvite stone, and it have the co-infection it have the infection with Staphylococcus pseudointermedia, and it have resistant to many antibiotics, but do have some sensitive to some antibiotics. My question would be, what kind of antibiotics you will choose for this patient, and how long you will use the antibiotics? Generally, for the very simple cystitis, bladder infection, bacterial infection, if it's a simple one, we just use a short course of antibiotics, like 3 days to 5 days or 1 week would be enough. But if a dog with a recurrent bladder stone and with a bacteria infection. And we need to use antibiotic for a very long time. We need to use it until the bladder stone would be dissolved. Why we will need to use that long time of the antibiotic? First is because bacteria would be very easily hiding in the bladder stone. So if we didn't use antibiotics until the bladder stone is 100% dissolved, then if we stop the antibiotic too early, the bacterial infection would be recurred very easily. So maybe will make our treatment fail. And what kind of antibiotic in this chart you will choose? Like, will you choose neomycin? No, because neomycin cannot be absorbed systemically. Will you use like other antibiotics like clindamycin? Probably. Or vancomycin? No, because it's too strong and need to give the IV. It'll be not easy for the client to use for a very long time and use at home. Generally, we need to use the antibiotic for like at least 1 to 3 months for a uroless patient to make the to until the bladder stone 100% dissolved. So, the antibiotic I will choose for Dodo this time would be the nitrofurantoin. It's an antibiotic is not very known by the most clinicians, and we are not use it very oftenly. But it's a very like a good antibiotic to use for the urinary tract infection. For the acute infection, we can use a dose like 4.3 mg per gig. But this medicine need to give like 3 times a day. For acute phase, we can use like just for acute infection, we can use for 7 days to 10 days. But for chronic infection, we need to use 10 to 14 days. But for patients like Bing, she have like a recurrent bladder infection and cystitis with bacterial infection. We need to use very long time. In the beginning phase, like in the beginning 2 weeks to 4 weeks, I may use a 4 dose 3 times a day. But in the following phase, if I assume the bacteria is being cleared in the most of the bladder, then I probably switch the nitrofurantoin to a maintenance dose, like 1 to 4 mg per kg, once daily, and admitted at the bedtime. Why we want to give like a low dose at a bedtime? Because we give the antibiotic at a bedtime. At that period of time, dogs do not walk, and she can hold the urine in the bladder all the time, so can make the antibiotics be more effective. So after the beginning phase for like 2 weeks to 4 weeks, we can switch the dose to a lower dose and a once daily bedtime dose. Sometimes it can still get effective. But this medicine, occasionally can cause gastrointestinal signs. This antibiotic, in China, we only have the human forms. There is no like specific design for dogs and cats. So sometimes we need to divide the medicine. So generally, we will put the antibiotic in intestinal dissolved capsules to make the gastrointestinal side effect into a lower rate. But for any case, if you assume that the patient will need a long-term antibiotic, just like Dodo, I will do the culture and do the sensitivity all the time. If just for 2 days, 3 days, 5 days, maybe we can just use like broad spectrum antibiotics like amoxiclav. But for a patient like Dodo need to use the antibiotic for 3 months, then definitely we will need a culture result to select an antibiotic for Dodo. So, and also for the why nitrofurantoin will be a very effective medicine, antibiotic for urolith patient. First, because it have high concentrations in the urine. Second is it will be effective against the common urinary tract infection pathogens. It will be works well against E. coli and other gram-negative bacteria. And also, it will have the low resistance development. Bacteria should be not easily to develop antibiotic resistance to the nitrofurantoin. And the fourth reason is it's suitable for long-term prophylaxis treatment because we need to use antibiotic for long term. This medicine is generally safe to use for long term. So we are treating the we are treating the bacteria infection, mainly just use nitrofurantoin. And at the same time, we need to treat the struvite stone. So we still let the patient eat only the urinary SO. SO is focused on struvite and calcium oxalate. So eat this food only, nothing else, and encourage the dog to drink more water, help to dissolve the stone. So, because in China, the only qualified the prescription diet would be from the Royal Canin. So the only choice would be the urinary SO. If in your country you have other choices, maybe you can choose other product like a Heels or Purina. But right now we only have like a Royal Canin. And for the prognosis, after 3 months of the continuous medication, antibiotics, and with the urinary diet at the same time, all the stones being dissolved. And we did a culture again before we stopped the antibiotic. Culture result would be negative. So if so, this case get a good result. So for this patient, what I want to tell you is sometimes the urinary stone, we need to know first it's caused, what kind of stone it is. We can use the Minnesota Urolith Center, these kind of applications to help us to differentiate what kind of urinary stone. We just need a lateral X-ray and this app. It can tell us what stone it is. And the second is for most of the struvite stones, we can just use the urinary diet to control it, to dissolve the stone. The third is if the stone dissolving didn't work, probably there are some underlying issues like urinary tract infection. We need to treat the urinary tract infection at the same time. And the antibiotic, whatever antibiotic you use need to use it as long as the dissolved being totally dissolved, then you can. And also the urine culture result is negative, then you can stop the antibiotics. Do not stop the antibiotic too early, or you will all your treatment will be failed. And this is another algorithm that can help us to differentiate what kind of urinary stone is. This algorithm is a long steps. It's not a very easy to use, but the accuracy is pretty high. Here is this algorithm is from the literature from the right side. It compared the Minnesota Urolith Center the application and also the this algorithm. Um, every case they did the surgery to remove the stone, and they already know what kind of stone it is. And they use the app and they use the algorithm. They find the app's accuracy would be around 75%, but the algorithm's accuracy would be 95%. So the except the app, you can also use the algorithm to help you to differentiate what kind of stones you are dealing with. So you can focus depending on the stone type, you can plan your treatment protocol. And also, Bioguard, they have invited, they have provided us a kind of machine, is antibiotic susceptibility test analyzer. It can do in-house the culture and sensitivity, bacterial culture and sensitivities. They can just use like a urine sample put into one incubators for the beginning, for the first step, and it will tell you that if there is like bacteria or not. And the second step is put a liquid in the incubator 1 to the incubator 2. And the second part, this machine can tell you what kind of antibiotics can work for these bacteria. So it very quick can just get a result within 1 day. It sometimes can help with your clinical decisions. And there are two panels to focus on different kind of antibiotics. So this is our first case. The second case is ice cream. Ice cream is a 6 years old male nurtured samoyed, and he do have the problem with dysuria. We can see in the X-ray in the left side, here is a bladder. In the bladder, there are very tiny storms inside. And also this dog have the problem with the issue. He cannot empty his bladder because there are some bladder stones in the urethra as well. And also in the ospinis and can cause a problem with peeing, he do have the dysuria. So for this patient, we also did a urinalysis for him. And we, in the urinalysis, we do see this kind of crystals. Do you know what kind of crystal it is? I can give you like 10 minutes to 30 minutes to think about what kind of stone it is. The crystal is, sorry, it's in Mandarin as well. It's cysteine crystal. Cysteine crystal would be looks like this. It's not like previously what we know already, the struvite crystals. So as the animal already have the dysuria and there's some blockage, definitely we will plan for the surgery. It's not a very good option to wait it to pee it out, because the stone in the os penis, it's very difficult to being dissolved. So we planned the surgery for the patient ice cream, and this is a stone. What we got, we did the culture as well, and we take the stone and send it to Bioguard reference lab. The stone, the result come back is not as we suspect. It's cysteine stone. It's 100% struvite stone. And there are some E. coli in the urine sample, and there are E. coli infection, and there are some antibiotics can work for the E. coli. So this case told us crystal type didn't equal to the stone type. Even the urinalysis, we do find it's cysteine crystals in the urine sample. But at the end, after we did the surgery, we found it's struvite stone. So we cannot use a crystal type to predict what kind of stone it is. Still, we need to use is otherwise MU Urolith Center this application or this algorithm and to help us to differentiate or know what kind of stone it is. Then we will just treat this kind of stones. And after we did the surgery, we also give the antibiotic for sort of long time and to treat the bacteria infection and to prevent it to recur again as well. So the beginning two case is dog case, and our third case would be come to cat patient. The third patient cat is Cha Cha. She is a 4-year-old female spayed British short hair. She do have the clinical sign like plaqueuria, hematuria, stranguria. She go to the cat litter very often, and we do see the in cat litter, the urine clot would be a very small ones, and sometimes we do see hemorrhage inside. So for this patient, first step, my plan would be do a ultrasound to see what happens in the bladder. We can see the bladder wall is getting thickened. There's some cystitis as well. And also we do see the urolith, the bladder stone inside. There are like echogenicity is getting pretty high, and also there are some shadows behind. It's typical what a bladder stone will look like in the ultrasound. As we already know, this cat have cystitis, have bladder stone, and what's your plan as next step? First, we'll do a urinalysis, or you will do blood work, or will you try to take an X-ray for the cat, or fourth, you will just start the treatment, and or like surgery, we can do a surgery just to remove the stone. What's your plan for this patient? Can give you like 20 minutes to think about. So before we go to next step, I want you to have a review. First, is what kind of what blood work can told us. It generally can tell us nothing if there is inflammation or not, if the white blood cell is high or not. Generally is not, we will look for the urinary tract patient. If the clients have a deep pocket, the client have a lot of money, definitely you can do blood work, you can do everything, urinalysis, blood work, CBC, chemistry, X-ray, everything. But for this patient, the essential thing would be the X-ray. We need to take X-ray to see what the stone it is, because we already know urinalysis and to see what kind of crystal inside cannot tell us what kind of stone it is. So every time we are treating the urolith, the bladder stone, the first thing we need to know what kind of stone it is. Then we can make our treatment plan because different stones have different treatment protocols. So urinalysis cannot give us a hint what kind of stone it is. And also, like most of the cat with a cystitis doesn't matter, and with and or with a urolith, there is no bacteria infection, not like dogs. Every time in dogs we do see struvite stone, it have the bacteria infection. But for cats, if we do have the urinary stone, doesn't matter it's urolith, doesn't matter it's struvite or calcium oxalate or urate. It's 90% or 95%. It's clear. There is no bacteria infection. So urinalysis can tell us barely nothing very important, very strict. The blood work can tell us nothing special. But why X-ray is important and why we do not start the surgery at the very beginning. Here is two X-rays. Left X-ray is for Cha-Cha. Right X-ray is for other patients. We can see there are bladder stones in the urolith in the bladder, but there are some difference. Let me see if I can show my pen. Oh, sorry, it cannot work. Okay, then we start the X-ray. Okay, so in the left side, can see the urolith. The right side, there are uroliths inside as well. But these two uroliths, they are different types. Left one would be the struvite stone. Right one would be calcium oxalate stone. How do we know? Just through X-ray, we compare the opacity of the stone with the cortex of the bone, of the femoral bone. If the opacity of the urolith is equal or similar to the opacity of the cortex of the femoral bone, then it will be the calcium oxalate. If the stone's opacity is lower than the cortex, then it would be the struvite. So left side, the stone opacity is lower than the cortex of the bone, struvite. Right side is equal to the bone, it's calcium oxalate. Why it's important that we know it's struvite or calcium oxalate? Because for struvite stone, the only treatment is still we can just use a urinary SO diet. It can dissolve the stone, like just maybe in 10 days to 2 weeks to 1 month, it can dissolve the stone. There is no need to do the surgery. But for the calcium oxalate stone, we cannot dissolve it. And doesn't matter what kind of the diet you use, we cannot dissolve it. The only treatment is to do the surgery. Surgery is the only treatment. So this is also from the Minnesota Urolith Center. They do have this kind of epidemiology research in 1990 something. The most major stone type would be 80% would be the struvite stone. And calcium oxalate and the purine and cystine stone, they are in a very low frequency. But in a most recent, like 2005, the struvite stone, the frequency is getting lower and lower. But calcium oxalate stone, we do see more in the Minnesota Urolith Center. Why this will happen? It's not because the stone, the epidemiology is changing. Cat have more calcium stone, cat have lower struvite stone in a recent year. No, the current the happens rate is similar. Still, 80% of the cat, or more than 80% of the cat, if they have the bladder stone, the stone type would be struvite. But in 1990s, every cat with bladder stone, we will do the surgery to remove it and send it to the stone, send it to the Urolith Center, and they come back with a report. It's struvite. But in recent years, we find if we only use the urinary diet can dissolve the stone, there is no need to do the surgery to the struvite. We only need to do the surgery is calcium oxalate stones. So we have the Minnesota Urolith Center. They do have less and less samples, the struvite samples. So in their research, or in their center, they do have more calcium stones. They do have less struvite stones. But just because the struvite surgery, they do less surgery for the struvite. They just use urinary SO diet to dissolve the stone, no longer use do the surgery for this kind of patients. So, but for the calcium oxalate, surgery is still the most important thing and the only treatment. And this is Cha-Cha. After 1 month of the urinary SO diet, all the stones been dissolved. So we can just use a stone. We can use a urinary diet to dissolve the stone. And also we can use X-ray to differentiate what kind of stone it is. This is information I want to tell you from this case. And the final case is Mango. He is a 3-year-old domestic short hair, also with the struggle urea. And but this cat is a block cat because through the palpation, the bladder is pretty big. For a block cat patient, we will do many exams, but a very important test and would be very easily to ignored by clinicians would be still X-ray. And the X-ray for block cat would be different. Regular X-ray, abdominal X-ray is we taking X-ray like this. But for a block cat or lower urinary tract disease cat, we want to take X-rays like this, like a green box. Why we want to take X-rays like this? Let's have this X-ray for Mango. We can see in the pelvis area, there are some stones inside. If we didn't take X-ray, if we just did the ultrasound, or we did the X-ray for the abdomen area, didn't include the os penis area and the penis area, then we cannot find the stones. There are some stones inside. And here is four examples of they are all blockades. The left left upper one, it's a blockade. We can see in the penis area there are many sludge inside. That's the reason why it causes a blockage. Left bottom one is there some stone inside. That's the reason why it cause a cat have the blockage. So we can use the X-ray to help us to differentiate what's the reason cause blockage, and also to see if there is any stones in the urolith. And also, we did the ultrasound. There's some free fluid in the abdomen. As we know, there's some fluid. We would always worry about the urine abdomen. So we take the sample out. We compared the free fluid, the creatinine, and the serum creatinine to see if it supports the uro abdomen. But do not use a BUN to test, because BUN is very small and easily diffusible particles, and very it can very quickly get in equilibrate. So cannot use it to differentiate if it's a uroabdomen or not. So for Mango, this patient, the fluid creatinine is lower than the blood creatinine, so it'll be normal. It's not a uroabdomen, and also we did a blood gas. The creatinine, BUM, and potassium level is pretty high. We know for this patient, we need to do the unblock the cat and put a urine catheter on. Generally, we will need to do the general anesthesia. But for a pretty the hyperkalemia patient, the anesthesia risk would be higher. This is a hyperkalemia patient anesthesia considerations. For potassium is higher than 6, we will do general anesthesia in a very cautious status. If lower than 4.5, 6.5, we will just give the fluid like a ringer solution and the normal saline to decrease the potassium level. If the potassium level is in the 6.5 to 8, then except we will give the dextrose IV fluid like 0.5 ml per kg dextrose, and diluted one 50-50 with normal saline, and we give the IV bolus, use the dextrose to decrease the potassium. If the potassium level is higher than 8, then we will give the fluid, we will give the dextrose injection. At the same time, we will give the regular insulin IV, and also the calcium gluconate to manage the patient. Regular insulin is help to decrease the potassium, because insulin can let the potassium in the blood to go into intracellular, so can help to decrease potassium. The calcium gluconate is mainly just to protect the heart. It cannot decrease the potassium, but can protect the heart to do not to go to the arrhythmia. And at the same time, we can also give the sodium bicarbonate. it can make the especially for patients with acidosis. It can treat for the acidosis, and also it can decrease the serum potassium level. So after we give the glucose injection, we also flush back the stone in the urethra to the bladder. And for Mango, we did a bladder surgery to remove all these six stones. And we also did a retrograde contrast to see that the bladder wall is intact. There is no leakage, there is no uroabdomen, and all the stones being taken off. And definitely, we send the stone to the Bioguard reference lab, and the result come back would be the calcium oxalate stone. It cannot be dissolved. It can just only be a surgery patient. But for every patient with calcium oxalate stone, we need to keep an eye on the electrocalcium, ironized calcium, because many of the cat they will have the chance to develop the calcium oxalate because they do have the hypercalcemia. Previously, in the blood gas, the ironized calcium is lower than the normal range. That's the reason, and that is because the animal is critically ill. For a critically ill patient, they will very easily to have the hypocalcemia. But once their condition is come back to normal, the calcium level would be high again. So we need to treat the hypercalcemia to prevent the stone happens again. We also need to know why cats will have the hypercalcemia. There are several reasons, like the hard irons. We did the PTH tests. It's in the normal range, so it's not hyperparathyroidism. It's less likely Addison's disease. The renal level is go back to normal, so the hypercalcemia is not caused by the renal disease. There is no vitamin D toxicity. We are not giving any phosphate binder. Any supplement can increase calcium. There is no osteolysis. There is no neoplasia, and we repeat the test. The calcium is continuous high, so it's not due to a superior hypercalcemia. Then most common reason and the most commonly seen for cats with the hypercalcemia would be the idiopathic. It's mainly for cats. So for the cat, for Mango, we keeps giving her the urinary SO diet. First is to prevent the calcium oxalate to recur again, and also we can give some fiber like psyllium husk to treat the hypercalcemia. I have many patients with idiopathic hypercalcemia. They respond well to the psyllium and psyllium husk. It's kind of fiber can manage the hypercalcemia. So that's the last case I want to share with the audience. The tips and tricks for the feline patient. The last case is we need to take X-ray that includes the urethra for blood cats. And also we need to know what's the reason why cat getting blocked. And if the cat is blocked due to the calcium oxalate, then we need to do the surgery, and also we need to keep an eye on the hypercalcemia and treat it. That's all the thing I want to share. Thank you, everyone. And if you have any questions, can just let us know. Okay, so if there is no further questions, then I will send the point to robot, and the robot can send the slides to
Dr.
you.
Cao, there are some questions in the 问与答 the Q&A.
Oh, okay. 我看 I didn't there is mainly want the PowerPoint want a recording. I let me check if there is any questions. Robert 有看到什么问题吗？
有，你可以从最后面往上看。好，第一个，那我可以念一下。
可以。
Could you please tell me which type of stones are more often at dogs generally?
For dogs, it would be um, depending on the breed, depending on the gender. If it's and also depending on if there is any bacteria infection or not. Generally, for if it's a female dog, most of the time what I see is struvite stone. Because for females, they would be very easily to have the bacteria infection. So bacteria infection can induce the urolith. So for the female dog, like 80% would be struvite, especially if you see the bacteria infection in the bladder. But for but for male dogs, it's probably like a 50-50. But recently, as a dogs, they are eating more commercial diets, so still more likely the struvite stone compared to the others. Some male dogs can have the bacteria infection as well. So number one, still struvite. Number two, the calcium oxalate, but depending on the gender.
Okay. The second question is, what should I do if nitrofurantoin is not available in my country? Which antibiotics will be the second option safe for prolonged use in UTI?
I have like it's truly depending on the culture result. So you need to get the culture result first, because culture it can tell you which antibiotics would be sensitive to these kind of bacterias. I will not use antibiotics blindly for like 3 months. It's too long and it can cause antibiotic resistancy. But if I do not have any choices, probably the first line antibiotic like cephalexin or amoxiclav, this kind of antibiotics I may use. I will do not use more stronger antibiotics blindly. It will be very easily to cause the antibiotic resistancy.
Okay. Um, would you say that urinary SO is still sufficient for very large strobite stone for PX with dysuria and hematuria, or is surgery the option if the stone is already too large?
Okay. I'm not
I
pretty sure if it's the meaning is if the stone is too large, right?
yes.
Okay. I have seen a very, very, very big urinary stones, struvite, but still can be dissolved by the urinary SO. Just need a longer time, but doesn't matter how big it is, it can always be dissolved by the urinary SO. Just you need to control the infection properly. But if you do not control the infection properly, then it wouldn't work.
Okay, then here's would be the last question. Are there any breeds of dogs or cats that are particularly susceptible to bacterial infections when struvite is present?
For cats, I would say if you see struvite, I would not worry about the uh, urinary tract infection because most of the time, 95% or 99%, it'll be negative. If we do culture, it'll be negative. The one exclusion would be if the cat been previously put a urinary catheter on, if the cat previously been blocked and we put a urinary catheter, then the cat will have the chance to have the urinary tract infection. Otherwise, I would assume every cat would be not correlated with infection. But if you see a strange, weird recurrent of the cystitis didn't be controlled well through the urinary SO diet, then I will definitely do a urinalysis and do cultures to see if there is any underlying bacteria. And also, if the dogs or cats have the concurrent other diseases like diabetes, Cushing's, low immunity, then these animals in animal then would be more chance to have the bacteria infection as well. For dogs, I only care about the gender. For breed, I do not care too much, but I will check the vulva. Some female dogs, they will have a disease like called the recessed vulva. And the vulva is getting too long, and it will make the bacteria more easily to getting into the urinary bladder. And sometimes they even will need the surgery to repair the vulva to prevent or to treat the bacterial infection. So check the vulva's condition. And breed, it's not very correlated with the struvite stone. It's bacterial infection correlated with struvite stone. But some other stones like may correlated with breeds, like Dalmatian Schnauzer. They may have the we call it so what like urate stones or this kind of stones. It's breed correlated, but struvite no.
Okay, there's a follow-up question on diet management with too large struvite stone. How do you manage the dysuria?
How to manage the dysuria? Pain control, and but if the animal have the dysuria for a very long time, probably I'm not sure. Sometimes even the bladder stone is very big, but if we treat the bacteria infection properly, the dysuria will getting better. So if we need to know if the dysuria is the trigger is bladder stone or the bacterial infection. In my experience, is bacterial infection may be the trigger of the dysuria, but not the stone. Even though the stone is very big, some dogs can tolerate it pretty well. But if really the owner cannot tolerate it, the life quality of the dog is pretty was pretty bad, and then yes, we can do the surgery to remove the stone. And just the surgery itself will need 2 weeks to heal. During the healing period, the dog will suffer from the pain, suffer from the dysuria, or suffer from the plaqueuria as well. So it's a balance. You need to balance the pros and cons of the surgery and the medical treatment.
Okay, this would be the last question for this webinar. In 14 years old domestic short-hair cat have stones in both kidneys. Can we go for a surgery?
Oh, for stones in the kidney, I would probably not. Um, if sometimes this kind of stones, they are very commonly would be the calcium oxalate. So generally, it cannot be dissolved. The If we need to do the surgery, or it's necessary to do the surgery, is because the stone cause blockage of the the urethra and cannot ureters. So, but the stone is not we open the kidney. If the stone is blocked the ureters, probably the thing we will do is do the bypass, the sub. We bypass the ureters to make the kidney function. But for the kidney stone itself, I generally do not do the surgery.
Okay, that would be the last question. If uh, the questions haven't been replied, we'll forward the question to Dr. Cao and then reply you through the email. And thanks to Dr. Cao for the excellent lecture today. And thank everyone for attending this webinar. We are looking forward to seeing you again in our next webinar. And good night.
Good night. Bye bye.